So we have a very elaborate mechanism for quality control and quality assurance. In the first place, before you come on board, there are certain hoops that you have to jump through. The law says that you have to be HEFAMA accredited, right? But when you do come to us and say, oh, I want to join the scheme, there is still a whole spectrum of stuff that's going to be done. They will come and inspect. They will give you a quality improvement plan. They will tell you whether you met the standard or not, and if you didn't, they will leave you with a quality improvement plan to go and work on. And when you're ready with all the things they've asked you to do, you can come back. And it is only when you have met that limit that you now go and become onboarded onto the scheme. Now, once you now come onto the scheme, and there's all the trainings and everything that will be done, and they'll walk you through all the SOPs, there are operational guidelines, there are standard treatment guidelines, there's an essential drug list, etc. All providers are armed with all of that. You are also taught on the ICT platform, because we are ICT based. We don't use we're not paper based, so you'll be taught how to access the platform and upload all the things that you need to interact with or to provide to the agency. We have a quality team that are spread across all the divisions of Lagos State, and every month they walk into these facilities. They have a checklist. They will look at files, they do clinical audits, and if they see any issues, it is red flagged, and the hospital is called to attention. We have a whole arm of LASHMA dedicated to regulation, and what that means is that when the quality team have done their checks, if there are issues that have not been able to be resolved at that level, the regulatory team now steps in and they visit that hospital. And if you'll be issued, there is a whole spectrum of what they go through. If they have issues with what has happened, you get issued a letter of warning, and they will keep monitoring you. If you do not conform to what has been asked, eventually the last thing that will happen, you are fined, and eventually you are delisted or blacklisted, and you will not be able to provide care to any ILERA EKO enrollee until you have gone the whole ramot again of coming back. And so it's a continuous cycle of ensuring that hospitals are providing the care that we want. We also have a 24-hour call center. It is toll-free. We have people doing shifts, sitting on those lines to ensure that if you call in at any time, somebody will pick that call. If you have an issue with the facility, what we notice is that many people just walk away out of annoyance and say, oh, it's a government program, so, that sort of thing. No, you've paid for something, it's your right. And that's why those people are there, not sleeping, waiting for you to call in. If you have an issue, there's a confusion, maybe the provider is telling you this thing is covered, is not covered, and you feel that it's covered. Call and, query the call center. They will sort it out for you, and they will engage the facility. And that is also recorded. Every week on Sunday at 4 p.m., I get a list of the complaints that have come in on our hospitals. And that is passed to the quality and the provider network team to work on the following week. So it's in real time. Okay. There isn't any, how would I call it, like a time lag. And we are constantly addressing these complaints. So we want people to reach out to us, because it is what we know that we can deal with, right? Things that the quality team go into the facilities for, that is from our perspective as your clinician. But there are things that matter to a customer. I'm not a customer. Right? I expect you to raise attention. If there is an issue that you feel from your customer perspective it's an issue, raise it through the complaint center, and that is taken on board and worked on to ensure that when you go back to that hospital, that sort of thing will not happen. The hospital is either penalized, So this is a continuous cycle. We have responsibilities, but it's always good to tell our customers that you also have a responsibility to escalate to us. Let us know. You can't complain about something that you did not draw our attention to. Once we hear it, we are responsive and we are working on it. It's a continuous cycle. Let us work.